Dr. Marcus, what is the purpose of the Aviation Public Health Initiative?
The purpose of the Aviation Public Health Initiative is to bring science to questions of reducing risk for passengers and the workforce in the aviation industry.
How did the Aviation Public Health Initiative come about?
My research at the university is studying leaders in times of crisis. So as part of that study, when we talked to aviation leaders, they were looking for a scientific framework to help them address how to reduce risks in the midst of COVID-19. Because of that question, and with their encouragement and support, we assembled a group of scientists, infectious disease, epidemiologists, environmental health, who came together to address specifically those questions of reducing risk in the aviation industry.
This research was sponsored by the aviation industry. How can we be assured that this is independent?
We at Harvard University made an agreement with the aviation industry that we would go forward with this research on the condition that it would be independent. So here we have an important example of academia and the business world working together through this COVID-19 crisis. And they maintained that independence for us throughout the research.
Dr. Marcus, you are an expert in crisis leadership. What is the relevance of crisis leadership in this project?
We teach leaders in times of crisis that your top priority is developing good situational awareness. When we spoke with the aviation industry leaders, we recognized that science would be their best venue for building that situational awareness. So we brought together a team of top scientists, looked at the key questions facing the aviation industry, and our report speaks to the very situational awareness necessary both for the aviation industry and for the traveling public.
You recently released phase 1 of your research focusing on the risks of coronavirus transmission aboard planes. Can you tell us what the research found?
What we found is that through a layered approach that combines the ventilation systems and disinfection of the planes and compliance with mask wearing, that combination significantly reduces the risks for people who are flying, even though you're in a very tight environment when you're on the plane.
If you were advising someone about to take a flight, what would you recommend they do?
Before your journey, create a COVID plan. Have your face mask ready. Be ready to wash your hands regularly. Ensure that the people around you are wearing their face mask on the plane. If you have to take it off to drink or eat, slip right underneath your mask and keep yourself mindful of COVID-19 throughout the journey. If you do so, you can reduce the risks that you will acquire the disease or transmit the disease. It's our responsibility through this pandemic.
Even if you feel you're okay on an airplane, aren't there other things travelers need to consider before they decide to fly somewhere?
Yes, and you have to plan out your whole trip and how you're going to keep yourself safe during the pandemic. Follow CDC guidelines, wear your mask, keep distant. If you do all of those things, you can go from home to your destination and back and be safe. Follow the science, follow the recommendations of public health agencies.
Would you feel comfortable if your own children or elderly family member were to fly?
Yes, I'm asked that question often, and my answer to people is yes. And you have to follow public health recommendations about wearing a face mask, keeping yourself distant. And if you do those things, you can fly. I'm planning to fly myself.